Good afternoon, everyone. Today we will discuss about work in a team environment. So what is a team? A team is a number of persons associated together in a work or activity. A group of people with a full set of complementary skills required to complete a task, job, or project. There is also a formula to become an effective team. The formula is individuals plus group skills plus group goals equals successful team. Environment: the conditions that you live or work in, and the way that they influence how you feel or how effectively you can work. Workplace: a place where people do their jobs. Teamwork: the combined actions of a group of people working together effectively to achieve goal. Team roles: tendency to behave, contribute, and interrelate with others in particular way. There are 9 team roles that underlie team success, and divided into 3 categories: action-oriented role, people-oriented role, and thought-oriented role. The first team role is the shaper. In a team, the shaper role is performed by people who are dynamic and relish challenges. Rather than quit when faced with challenges, shapers maintain a positive mental attitude and strive to find the best ways to overcome challenges facing the team. Shapers are extroverts and possess great interpersonal communication skills and work toward motivating other team members. Second is the implementer. People who play the implementer role in a team are those who actually get things done in the team. They are practical, efficient, and well organized. Implementers turn the team's ideas and thoughts into actual plans. Because of their conservative nature, implementers are rather rigid and slow to accept change in a team. Completer or finisher. Finishers have an eye for detail. In a team, they are regarded as perfectionists because they are the ones who detect errors or omissions and strive to ensure that the team adheres to deadlines. They are neat and self-conscious and worry at the slightest sign of a problem. Finishers also have a problem with delegation. They would rather be overwhelmed than share their work with others. Next role is under people-oriented role, the coordinator. Coordinators are seen as possessing the traditional team role. They are mature and confident in nature and possess great listening skill. They guide the activities of the team to what they identify to be the team's obligation. Coordinators are good at delegating duties, but they may be manipulative when it comes to directing the team toward what they perceive to be its goals. Team worker. Team workers are the people who ensure the team remains united. They work toward resolving conflict or issues affecting the team's dynamics. Team workers are very supportive of other team members and are thus popular within the team. Team workers are known to be non-committal during decision making because they don't want to be seen as taking sides. They put team cohesion ahead of their decision making abilities. Investigator. Resource investigators are inquisitive and enthusiastic in nature and possess great negotiating and networking skills. They are extroverts, which make it easy for others to relate to them. Through their networking skills, resource investigators develop external contacts and negotiate for the team's resources. They are quick thinkers and good at getting information from other people. Next is the monitor evaluator, which is under the thought-oriented role. These are the critical thinkers in a team. They are serious-minded and cautious in nature. Rather than rush into decision-making, they prefer to critically analyze information before making any conclusions. Monitor evaluators lack the energy to motivate other team members and are deemed to be slow in decision-making. Specialist. Workers with expert knowledge in a particular area comprise with specialist role. Their contribution to the team is limited only to their area of expertise. Their priority is in maintaining their professional standards. Though they show great pride in their area of expertise, they show little or no interest in the expertise of others. Because of their expert knowledge, they're indispensable members of a team. Plants. Plants are innovative members of the team. They come up with original approaches and ideas that help the team in solving problems or overcoming challenges. Plants are introverts in nature and possess poor communication skills. Plants prefer to work alone. They react well to praise but are greatly affected by negative criticism. Next is the roles and responsibilities within a team environment, which are divided into three types. First is the task role. Task roles are roles that contribute to the ultimate goal of the group. Members who primarily fill these roles provide critical thinking and strong organizational skills. They are able to analyze problems and overcome obstacles to success. These roles include the ability to make plans and create accountability structures. Sometimes perceived as driven, those immersed in task roles are goal-oriented and keep the group focused and on the track. Productivity, efficiency, and achievement are important values to those who are in task roles, causing them to become frustrated in the group, waste time, or become inefficient. The second type is the relationship roles. Relationship roles, on the other hand, are roles that build cohesion in the group. They fulfill the important functions of creating trust and increasing member satisfaction. Members who fulfill relationship roles are aware of the interpersonal dynamics of the group and strive to encourage and validate others. While some may perceive these roles as overly concerned with non-task related issues, both task and relationship roles are needed to balance the group experience and increase the chance for success. Individual roles. The third type of the role describes behavior patterns that are not often beneficial to the group. Individual roles work against the group goals and distract the group from its mission. People who are playing individual roles are often frustrating to other members as they passively or actively resist the work of the group. While they may serve a function by challenging and thereby establishing boundaries, individual roles are generally seen as more of a hindrance than a help to a performance. Functional roles of group members. Under the task roles are the following: information seeker. Ask for facts, opinions, and ideas from the group, and for clarification and elaboration about existing concepts. Information giver. Contributes facts, opinions, and novel ideas to the group. Discussion facilitator. Facilitates the discussion by engaging the group. Task manager. Keeps the group on task and focuses on practical details. Skeptic. Challenges ideas and evaluates potential solutions. Recorder. Take notes and records the decision of the group. Next is the relationship roles. The following is under the relationship roles. Encourager. Validates, affirms, and supports others. Harmonizer. Mediates conflict between group members. Process observer. Observe and periodically comments on the group progress. Advocate. Helps quieter members to speak up and be heard in the group. Next is the individual roles, which consists of the following. Resistor. Opposes the group by being negative and passive-aggressive. Dominator. Dominates discussion and intimidates others. Avoider. Tries to do as little work as possible. Attention seeker. Calls attention to self to meet personal needs. Relationship with team members. Trust. This is the foundation of every good relationship. When you trust your team and colleagues, you form a powerful bond that helps you to work and communicate more effectively. If you trust the people you work with, you can be open and honest in your thoughts and actions, and you don't have to waste time and energy watching your back. Mutual respect. When you respect the people who you work with, you value their input and ideas, and they value yours. Working together, you can develop solutions based on your collective insight, wisdom, and creativity. Mindfulness. This means taking responsibility for your words and action. Those who are mindful are careful and attend to what they say. and they don't let their own negative emotion impact the people around them. Welcoming diversity. People with good relationship not only accept diverse people and opinions, but they welcome them. For instance, when your friends and colleagues offer different opinions from yours, you take the time to consider what they have to say and factor their insights into your decision making. Open communication. We communicate all day. The better and more effectively you communicate with those around you, the richer your relationship will be. All good relationships depend on open, honest communication. Communication process. This is the exchange of information and transmission of meaning. There are effective ways to achieve successful communication process. First is having one-on-one interactions. Successful teams are made of team members who are purposeful in their interactions. One-on-one interaction is important with every individual you hire to make sure employee engagement doesn't fall short in your workplace. Number 2, encourage two-way feedback. In order to have smooth work environment, it is important to have two-way communication. In workplace, feedback is important to generate results, where the main objective is to strengthen progress towards company goals. Number 3, show appreciation. Tell your employees, co-workers, and colleagues about how much you care and respect them. Showing appreciation is an effective way to deal with low employee morale and to make your team members feel like they matter. Number 4, conduct team building activities. It can help people to communicate better and also help to build good relationships with one another. Number 4, conduct team building activities. It can help people to communicate better and also help to build good relationship with one another. Fifth, use time wisely. Utilizing coffee breaks can keep team building spirit strong and giving everyone an opportunity to get to know each other better. Team bonding is a better way to improve communication channels. 6. Promote communication and collaboration. Your team members will eventually be able to communicate better if they are able to collaborate with everyone well. Encouraging collaboration will promote diverse skills to make sure everyone is aware of ongoing projects. Last, use appropriate platform of communication. Every project needs an effective communication stream to reflect the progress of the project. The modern workplace is on its way to digital transformation, so you need to invest on key systems and applications for productivity and communication. According to the needs of your project, communication tools can be an effective way for the whole team to meet up. Team structures refers to the composition of an individual team or of a multi-team system. Team structure is an integral part of the teamwork process. Group planning and decision making. The performance of a group involves taking into account the needs and opinions of every group member. Being able to come to an equitable decision as efficiently as possible is important for the functioning of the group. There are several steps for group planning and decision making which needs to be considered. First, identify the decision to be made. Before beginning to gather information and list alternatives, it is important for you as a group to understand clearly what you are trying to decide so you have a goal on which to focus on your discussion. Analyze the issue under discussion. Once you have defined your goal, for example, the decision to be made or the problem to be overcome, examine the data and resources that you already have and identify what additional information you may need. Establish criteria. Identify the criteria or condition that would determine whether a chosen solution is successful. Ideally, a solution will be feasible. Move the group forward and meet the needs of every group member. Brainstorm potential solutions. Using the resources and information collected above, brainstorm for potential solutions to the problem or decisions identified. This involves collecting as many ideas as possible. At this stage, ideas should not be criticized or evaluated. Evaluate options and select the best one. Once you have a list of potential solutions, you are now ready to evaluate them for the best alternative. Implement the solution. This involves identifying the resources necessary to implement the decision, as well as the potential obstacles, then taking actions. Monitor and evaluate the outcome. Evaluate whether the decision was successful. Unity of purpose, the chief distinguishing feature of a team. Specific objective of a team. SMART. Be specific so that what has to be achieved is clear. Measurable, so the team knows when it has to achieve it. Achievable, so the team takes it as a culture of excellence. Relevant and realistic, so the team feels motivated and has a positive work attitude. Time-bounded, so the deadline to achieve a goal is clear.
Hi! In this video, you will learn about the importance of teamwork in your day-to-day work within business and outside of it. Teamwork is a term used for joining the efforts of bringing members in a project or business together to achieve a common goal. The members of the team work together effectively as a group with the aim of increasing productivity and performance. In this video, we will explain the 5 reasons why effective teamwork is essential in any organization. Teamwork creates a smoother and looser structure by developing a friendly environment, where leaders are not trying to be bosses, but rather work together with members as a team. This helps build strong bonds between the members. Teamwork encourages flexibility, since by working and communicating together, teams enable different perspectives to be considered and thus allow the business to respond to change faster. Teamwork enhances problem solving by combining different solutions, abilities, and talents into one big productive unit, and allows new ideas to flourish and goals to be achieved faster. Teamwork improves productivity, since the performance and knowledge of an individual is limited compared with a group of varied skill sets. Teamwork motivates the workforce and creates a healthy environment between the team members, which is essential given that most people spend time with their colleagues more than they do with their friends. Smart leaders encourage good teamwork and give teams the authority to take decisions based on what they see is right. Smart individuals learn how to work well within a team, since that is becoming more and more important in all fields of work. Great teamwork translates to great performance when it is managed well.
Welcome to Segment 5, What Makes a Team, Teams and Teamwork in Healthcare. In the last segment, we heard about some of the changes in the healthcare landscape that are moving us towards increased interprofessional collaboration. In this segment, we're going to focus on what makes a team. We'll provide you with a framework for thinking about how members of different professions work together. And we'll discuss some of the barriers and facilitators of interprofessional collaboration. There are many different types of teams in healthcare, ranging from a resuscitation team in the hospital, to a surgical team in the operating room, to a primary care team in an outpatient clinic. There are a number of key features of teams described in the literature. Teams have a shared identity and shared goals or purpose. They have shared responsibility for achieving these goals. Team membership is defined, but may change over time. And this is perhaps one of the most difficult things in healthcare, because team membership does often change over time, and members must be able to work together to achieve goals despite these changes. Members of a team are interdependent upon each other, and each team member's contributions are required in order to reach the team's goals. And finally, teams generally have the authority to act and make decisions autonomously in order to be able to carry out their tasks. One example of a team would be the team that works together in the acute care for elders unit at San Francisco General Hospital. Let's hear from Dr. Edgar Pierluisi, the medical director of the ACE unit at San Francisco General Hospital, about the ACE team goals and the team membership.
The goal of the ACE team is to return hospitalized older adults back home after the hospitalization. We do that by trying to maintain physical function during the hospital stay and to avoid many of the complications that older adults face. Well, the center of the ACE team is the bedside nurse. Our goal is to make sure that they have as much knowledge as they need about the patient, as well as to make sure they have a good plan of care for the day. They're supported by occupational therapists, a nutritionist, a pharmacist, a social worker, a clinical nurse specialist, and a physician.
What about interprofessional work that doesn't occur in teams? Although there's a movement towards more team-based care, there are countless interactions between healthcare providers from different professions that don't occur in teams, as we defined earlier in this segment. In his book on interprofessional teamwork in healthcare, Scott Reeves presents a framework for thinking about how healthcare professionals work together. In this framework, he describes several looser forms of interprofessional work, where members have less of a shared identity and integration of members is less important. These include collaboration and coordination, as you see on this slide. This diagram depicts the differing forms of interprofessional interaction to convey the level of connection that each requires. Teamwork is at the center because it requires a high degree of coordination amongst members, whereas collaboration and coordination require less connection. In collaboration, there's shared accountability and some interdependence, but team goals and roles and team tasks may be a little more unpredictable and less well-defined. Shared identity among members is less important. An example of interprofessional collaboration would be individuals taking care of a patient in a large general medicine ward. There are nurses, pharmacists, physicians, physical therapists, and social workers who work together and communicate about patient care in the course of their day, but they don't necessarily have a strong team identity. There's some interdependence in their functioning in order to care for these patients. But aside from an interprofessional weekly team meeting, there's limited interaction. In coordination, healthcare professionals work together, but integration and interdependence are much less important. Providers function independently for the most part, working in parallel. Team tasks are less urgent, they're less complex, and they're more predictable. Coordination does require some shared accountability between healthcare professionals and some clarity of roles, tasks, and goals. An example of coordination would be a sports medicine practice comprised of physicians, nurses, and physician's assistants who work with a physical therapy group in the same building. Although there's some degree of communication that occurs between the sports medicine providers and the physical therapy group, they are for the most part working in parallel, and they only communicate when the need arises. Now that we've discussed some of the different forms of interprofessional work, from teamwork to collaboration to coordination, let's focus on some of the barriers and facilitators to interprofessional collaboration. We've discussed some of the driving forces moving us towards interprofessional collaboration. You can see them here in this diagram. We talked about patient characteristics, shared competency between the professions, some of the efficiencies that can occur when we work together collaboratively, and then finally some of the policy issues that are driving us more towards a collaborative practice. What are some of the barriers or restraining forces? Well, despite an increasing focus on interprofessional education, many healthcare professionals lack those critical skills in communication and teamwork that are necessary for us to be able to collaborate effectively. We also train our healthcare professionals in silos, and each profession has its own values and perspectives. Although these varied perspectives are helpful and add a richness to collaboration, they do pose a barrier as well. Some of the existing infrastructures in our system, including schedules, lack of time for team meeting, lack of rewards for collaboration, can be barriers to collaboration. And finally, existing reimbursement structures don't always foster interprofessional collaboration. Some of the key learning points in this segment: interprofessional work takes a number of different forms, ranging from teamwork to collaboration and coordination. Teamwork is a more tightly coordinated process, and it requires a high degree of connection and a shared identity amongst team members. And then finally, we touched on some of the important barriers and facilitators to interprofessional collaboration. What types of interprofessional work have you observed in your own setting, and how would you characterize this work? Is it teamwork? Is it collaboration? Is it coordination? And why would you characterize it as such? I look forward to hearing from you in the discussion forum. Welcome to segment 6, Teamwork in Action. In the last segment, we talked about different forms of interprofessional work, ranging from teamwork to collaboration to coordination. And we heard about the team that works on the San Francisco General Hospital Acute Care for the Elders Unit. In this segment, we'll have the opportunity to see the ACE team in action and hear about some of the challenges they face in working together. One of the key components of teamwork is communication. Let's hear from Dr. Edgar Pierluisi about how the ACE team works together and communicates during rounds.
Our team works together through ACE rounds. Our rounds are every day for about 45 minutes, where we round on all the patients in the unit that are in the ACE program, anyone over 65. What we do is, having seen the patient, we bring our own understanding of what the patient really needs to recover from whatever illness they have, and we discuss it as a group. And then we create a care plan for that day. We communicate to the primary team. If we need to talk outside of rounds afterwards, we page or text each other, and we have those communications all the time. We communicate during ACE rounds using a formal approach to the nurse's presentation. So we have a checklist that we ask the nurse to present off of, so the listeners know what to expect. And it gets the nurses thinking about patients in a systematic way. And then we also have an order for who presents when, so that there's no confusion about who's going to say what, and it minimizes interruptions. And finally, I try to summarize what comes out of the meeting so that we're all in agreement before we move on to the next patient.
Now let's listen in on the ACE team morning rounds. As you listen to the rounds, pay attention to the communication in the team. Are members prepared to discuss the case from their discipline-specific perspective? Do all the team members contribute to the discussion? Is the discussion distributed amongst the team members, or is one member dominating? Finally, do team members appear to value and respect the opinions of others on the team?
All right, Joyce here, so let's go ahead and get started.
Okay, good morning everyone. I have Mrs. S. She's a 78-year-old female, admitted from the medicine service. She's here because she had a fall at home. She was carrying her laundry and fell down the stairs. And with that, she sustained a right hip fracture, and it's day 2 of her IM nailing. So for her past medical history, she has hypertension and COPD. Her vitals this morning are stable. She's off oxygen now. She has good vision. She has cataracts, but she sees pretty well. Her hearing is perfect. For her skin, she sustained a laceration on her right forehead, and the elbow has a laceration as well, but I've covered it with Curlix. For safety, she is on a false risk, considering her fall at home, although she's not trying to get out of bed, but we're just putting that for safety. Mobility is such an issue. because she doesn't want to get out of bed. She refused PT and OT yesterday. And it's because of her pain. She has 8 out of 10 pain. It goes down with her morphine to 4 out of 10, but it's still an issue. Her cognition-wise, I did mini-cog. She scored 2 out of 3 from the 3-item recall. And her clock is normal, and this is her cognitive screen.
Oh, great.
test.
Thank you. Yeah.
So it was reported overnight that she was confused. She pulled her IV and it's been replaced. Now we covered it with Curlix. And for nutrition, she ate good breakfast. She ate 100%. She doesn't have any dentures. And for today, I think I need to work on, we have to address her pain, elimination issues. She still has a Foley and no BM for 3 days. And we should work on her mobility so we can get her walking soon. Thank you.
Any pressure ulcers?
Oh, I haven't seen the skin at the back, but
Okay.
it was reported that she has blanchable redness on her back.
Okay, I'll take a look at her skin after the rounds.
Okay, we'll do it together.
Okay.
Okay, great. Thank you, Joy. Just a little bit of additional history. There's no history of urinary incontinence at home, but she does have mild constipation, which she treats with diet mostly. She does have insomnia, and her primary doc is giving her some zolpidem for that, and she uses it quite frequently, 4 to 5 times a week. Regarding her abnormal mini-cog, I did speak with her daughter, and she says she's had no issues at all with wandering or leaving stove on or whatever, but she has forgotten to pay some bills, and so her daughter is now doing that for her. This morning when I saw her, she was oriented. She passed her 5-digit recall. So she doesn't appear delirious at the moment, but as you know, it waxes and wanes, so it's something to watch out for. She may become confused later on in the day. I did try to get her out of bed and only got as far as dangling her legs, mainly secondary to pain. Given her abnormal testing and this history from the daughter, she probably has mild cognitive impairment or even dementia, and so I'll ask the team to check a TSH and a vitamin B12. And then given the fall, I'll ask that they start her on some cholecalciferol. Finally, I think we should stop her zolpidem and her haloperidol, but we'll talk about that more when Nam presents, and we can also discuss her pain regimen then. Susie?
Yeah, thanks to Janae's help in doing some research, found out her baseline. She lives alone. Her husband passed away 2 years ago. Her daughter and her daughter's family check on her a couple times a week. This is her first fall. She is independent with ADLs, and with most instrumental ADLs, her daughter has taken over paying for some bills because she's forgotten to pay for a few. But other than that, the daughter feels like she's safe at home. She does take the bus, sometimes gets a ride from her daughter to see her doctor. She attends church on Sundays and was going to a senior center for some socialization and exercise, but has since stopped since her husband died. As you know, Joy, we've been trying to evaluate her, and the pain is really making it challenging. We haven't completed the evaluation, and until her pain is controlled, we won't be able to. But once we know, she might be able to go home with services, or she might need to go to a skilled nursing facility for some inpatient rehab before returning home.
Does she have any stairs at home?
She does. She has 5 stairs.
Okay. So recommending an in-home safety eval maybe?
When she's going, if she's going to go straight home from here, then definitely a home safety eval. If she's going to go to a rehab facility, that would be something that the primary team might want to include in the DC summary. One more thing I forgot to tell you, Joy, and we should prevent any complications related to the surgery. She probably doesn't have the ability to move that right foot up off the bed. So make sure that heel is floated, and keep her knee bridged so she doesn't get a knee flexion contracture.
Okay, I'll do that.
Okay.
So
No?
I looked at her meds. She's on her home meds. The only thing I'm concerned with is that, it's post-op day 2. Very common to get post-op delirium on day 2. Most likely in the elderly, it's due to pain. She's only on IV morphine, but you said, does that help when she gets it though?
It goes down to a 4.
Okay.
It helps
Okay, but it doesn't control it, right? Okay.
Yeah.
Yeah, I was thinking, if that's okay, I was gonna suggest maybe Tylenol around the clock plus or minus oxycodone. See how she would tolerate that.
Yeah, I think that's a good idea.
If we can do that, so the 650 every 6 hours for Tylenol and then the oxycodone. She's a smaller lady, so let's start off with 2.5 Q4 around the clock, and then if she gets too sedated, then you don't have to give it. I agree with the vitamin D for the fracture. The other thing was she hasn't had a bowel movement for 3 days. She's getting a lot of morphine, so let's go ahead and add Senna to her regimen. Let's see. Did you want to talk about the haloperidol?
Yeah, I mean, my sense it should be stopped.
Yeah, and maybe it's probably all from the pain,
Yeah.
which is what I was thinking too. The Zolpidem, how do you feel about that?
Also, it has no role for her, maybe even contributed to her fall. I'd like to stop it, but it's something that her primary was giving. So I'd like to at least lower the dose if we could here.
Yeah, or we
but
can
talk with
even
the
try
primary.
like melatonin or something
Yeah.
if she really cannot sleep.
Terrific, yeah.
But those are just some things. We can run it by the team and talk to her about it too and see if she's comfortable with that.
Okay.
Okay.
All right. Janae?
The family's pretty involved with her care, but they work during the day and they're not able to take off. So if she were to go home, she qualifies for in-home supportive services and home health because she has both Medicare and Medi-Cal. But if she can't go home, then she pretty much qualifies for any skilled nursing facility. It just depends on how well she does. But I did notice that she seemed a little sad. The daughter said that since her husband died, she had cut back on activities. Do you think that she looks a little bit depressed?
It's hard to tell because she's always in pain, so I cannot distinguish at this time.
Yeah, I agree. It really was hard to tell. She was kind of just lying there, but I really wasn't thinking of that when I went to go see her. So I can just see her after rounds and evaluate her formally for depression.
Yeah.
All right, so just to summarize, our recommendations then for this patient are, one, our usual mobility recommendations, remove the Foley catheter, adjust her pain meds with the Tylenol and the oxycodone, consider placing an ice pack on her right hip, lower the dose of the Zolpidem and stop the haloperidol, start a medication for bowel movement, and then check blood tests for cognitive impairment and start vitamin D, and then we'll check her after rounds for depression. Anything else?
Just as you know, Janae, and I would recommend this, you would know, if she does go home, an in-home safety valve for falls assessment
Yeah,
in
I
the
can
house.
put that on the home health.
Yeah.
All right, anything else? Great, let's move on to the next patient.
All right,
Good.
thank you.
Thank you.
Joy.
As you can see from this video of the ACE team rounds, the structured communication that the team uses during team rounds ensures that all team members have the opportunity to share their expertise and recommendations. It also ensures that the team is clear on the goals and recommendations for the patient and knows how the day will go. Although teamwork has clear advantages for patients, as we discussed in the last segment, there are definitely barriers to working together. Let's hear from the ACE team members about some of the challenges they face in working collaboratively.
Timing. Timing is very difficult because I have other rounds to go to, so it's not my only rounds here in the hospital. So timing is a big issue. For the nurses, they're giving meds in the morning, they're getting to know the patients, and then they have a break time. So right when they're supposed to be going to break, we're trying to call them in for rounds. Because my timing is I have to be here before because I have another round. So it's timing is always the issue. And getting the nurses when they're not giving meds but everybody's used to it and they see the value in it, so they do make the time to come see us.
Some of the challenges that I personally have is that when the social worker discusses social issues, I don't quite follow because they're very, she uses a lot of terminology which over time I've had to learn, like 5150, or this person is medically conserved, or I'm not even sure if I'm using the right words, but she uses a lot of terms that I'm not familiar with, which I'm sure in turn when I discuss medications, she also may not understand fully. So I think that is one of the challenges.
I feel like sometimes there are debating goals between the different disciplines, and so that takes some finesse, some ability to keep your mouth closed and listen to everyone that's presenting their opinions and expert opinions. And to ultimately, again, continue to consider that it's the patient's best interests that should be at the forefront of every decision made. And to be able to maybe accept that my priorities with regards to the patient's healing may come at a lesser value in the moment than, let's say, the pharmacist's recommendations or the gerontologist's recommendations.
In this segment, we had the chance to see an example of how one team uses structured rounds to effectively communicate, and we also heard about some of the perceived challenges that the team faces in working together. What examples of team communication have you seen in your setting, and how does that communication compare with the structured rounds used by the San Francisco General Hospital ACE team? What are the main barriers to interprofessional collaboration in your setting? I look forward to hearing from you on the discussion forum.
Thank you everyone and keep safe always. See you soon. Ciao.